Assalamu alaikum friends. Today I am going to discuss question number 8 of Katherine Anderson, mrcog 1. As question number 8 is related to rectus sheath, so the content of these videos are rectus sheath, Spigelian hernia, rectus sheath haematoma and divarication of the recti. We will discuss this question at the end of the video. Now rectus sheath. It is a multi-layered aponeurosis or fibrous sheath of dense regular connective tissue. The rectus sheath extends from the inferior costal margin and the costal cartilages of the ribs 5 to 7 to the pubic crust. The walls are composed of a fusion of the aponeurosis of the external oblique abdominis, internal oblique abdominis and the transverse abdominis muscles. From superior to inferior, the composition of rectus sheath wall changed. It covers the interior and posterior surfaces of the upper 3/4 of the rectus abdominis muscle and the lower quarter of its interior surface. The lower quarter of the posterior surface of the rectus abdominis muscle isn't covered with the rectus sheath at all, but rather lies directly on the transversalis fascia. Now, formation of rectus sheath above the costal margins, you can see anteriorly it has external oblique aponeurosis and posterior wall is deficient, and the rectus abdominis muscles lies directly on 5th, 6th and 7th costal cartilage. Now between costal margins and the arcuate line, interiorly you can see there is external oblique aponeurosis and internal oblique aponeurosis interior fibers. And posteriorly you can see in this picture the rectus sheath has internal oblique aponeurosis posterior fibers and transverse abdominis aponeurosis. And you can see the internal oblique aponeurosis has completely covered the rectus abdominis muscle from anterior to posterior. Now below the arcuate line you can see the interiorly rectus sheath formed from external oblique aponeurosis, internal oblique aponeurosis and transverse abdominis aponeurosis, and posterior wall is there is deficit. Rectus sheath is present only anteriorly below the arcuate line. Now linea semilunaris. It is a vertical curved structure that runs along the lateral edges of the rectus abdominis muscle in the interior abdominal wall. It is a site of union where tendons of the lateral abdominal muscles meet the rectus sheath surrounding the rectus abdominis muscle. Linea semilunaris runs between the cartilage of the 9th rib and the pubic tubercle bilaterally. The 9th ribs are further apart from each other when compared to the pubic tubercle, which are close together, giving the linea semilunaris its curved shape. It is one of the weak areas of the interior abdominal wall and it is therefore susceptible to herniation. Now in this picture you can see linea semilunaris. Now linea alba. The linea alba is a strong fibrous midline structure of the interior abdominal wall formed from aponeurosis of interior abdominal wall muscles situated between the two recti abdominis muscles, one on each side. The umbilical or navel is a defect in the linea alba through which fetal umbilical vessels pass before birth. The linea alba attaches to the xiphoid process superiorly and to the pubic symphysis inferiorly. An abnormal widening of the linea alba is known as diastasis recti. During pregnancy, the linea alba usually darkens due to hormonal changes, whereupon it becomes known as linea nigra. The linea nigra sometimes also occur in either sex outside the context of pregnancy. Now in this picture you can see normal abdomen with rectus abdominis muscles and linea alba. In the second picture, you can see diastasis recti, which I am going to discuss in a few minutes. Now, content of the rectus sheath. Muscles present are rectus abdominis muscle and pyramidalis muscle. Pyramidalis muscles is not present in about 20% of the population. Arteries are superior epigastric artery, which is a branch of internal thoracic artery, and inferior epigastric artery, which is a branch of external iliac artery. Veins which corresponding to their arteries. There are lymphatic vessels present, and there are nerves, terminal parts of the lower 5 intercostal nerves and 1 subcostal nerve. In this picture, you can see rectus sheath encloses the rectus abdominis muscle and the inferior epigastric vessels passing into the rectus sheath. Now, functions. The function of the rectus sheath is to protect the muscles and vessels which it encloses. In addition, keeping the rectus abdominis and pyramidalis muscle together helps in providing maximal compression of and support to abdominal viscera. Contraction of the rectus abdominis and pyramidalis muscles causes flexion of the lumbar spine. And abdominal wall muscles also play a significant role in intra-abdominal pressure and provide support to the axial skeleton. The pedicle flap of the upper part of the rectus abdominis muscle, based on the superior epigastric artery, is commonly used in the reconstructive surgery of the breast. Linea semilunaris provides strength, mobility, and flexibility to the lateral abdominal muscles. A median incision through the linea alba is a common surgical approach for abdominal surgery. This is because it consists of mostly connective tissues and does not contain any primary nerves or blood vessels. Now, what is Spigelian hernia? Spigelian hernia occurs when the fascia of the linea semilunaris or Spigelian line is weak and segments of the intestines or peritoneum surrounding it to protrude through it or herniate. As the weak spots are usually narrow, there is a high risk of strangulation and infarction of the herniated part of the intestines. Now, strangulation happens when a part of the tissue herniates through the narrow opening, which in turn cuts off the blood supply to the herniated tissue and causes local death of that tissue, which is called infarction. Spigelian hernias are in most cases associated with obesity and are usually treated surgically. Now, in this picture you can see the site of Spigelian hernia. Now, rectus sheath haematoma. Collection of blood within the tissue is called haematoma. Any bleeding from the superior and inferior epigastric vessels contained in the rectus sheath can easily spread into and accumulate in the abdomen. This is because there is no strong epineurosis that will stop blood spreading below the arcuate line. There is only the transversalis fascia. Rectus sheath hematomas usually self-resolve without any treatment. Now, in this picture, you can see the rectus sheath hematoma. In this picture, you can see superior epigastric artery and inferior epigastric arteries are present in the posterior wall of the rectus sheath. So, any trauma can result in hematoma formation. The divarication, which is the separation of the rectus abdominis muscle of two recti muscles, usually occur in elderly multiparous women with weak abdominal muscles. In this condition, the aponeurosis forming the rectus sheath become extensively stretched. Subsequently, when the patient coughs or strains, the recti separate widely and a hernial sac containing loops of intestine protrudes through between the medial margins of the recti, and it is sometimes confused as a true abdominal wall hernia. Now, in picture you can see normal linea alba and the divarication or diastasis of recti. Your linea alba is a thin band of stretchy tissue that runs down the front of your abdomen. It expands like a rubber band during pregnancy. Now treatment, this condition can be unsightly, and when it is small, less than 2 cm, it can be treated with improvement in the abdominal wall muscles as advised by a qualified physiotherapist, including core contractions, squats against the wall, upright push-ups against the wall, and head lifts. And the surgical techniques have been documented in this literature and can involve both open and minimal invasive or laparoscopic methods. Whichever technique is used, the recurrence rate is higher than for most repairs, and one would quote this risk to be at least 10 to 15%. Now the question is the rectus sheath. The rectus sheath is made up of the aponeurosis of transverse abdominis and internal oblique. It is false because rectus sheath is made up of aponeurosis of external oblique, internal oblique, and transverse abdominis muscle. Below the arcuate line, the posterior rectus abdominis is separated from the peritoneum by transversalis, fascia, and connective tissue. It is true. Now, pyramidalis is external to the rectus sheath. This is false because pyramidalis is present inside the rectus sheath. The rectus sheath contains the ventral rami of lower 8 thoracic nerves. This is false because rectus sheath contains the ventral rami of lower 6 thoracic nerves. Contains an anastomosis between the internal thoracic artery and superior epigastric artery. This is false because superior epigastric artery is a part of internal thoracic artery. Anastomosis is present between superior epigastric artery and inferior epigastric artery. Thanks for watching. If you like my video, please subscribe to my channel and click the bell icon for more updates.